But first, the big story breakdown.
And in tonight's big story breakdown, we're looking at rural health care. This comes as the state gets a huge shot in the arm for health care in rural and small town Oklahoma.
Our state is awarded $223.5 million in federal grant money, just the first batch in a 5-year initiative. We are tracking that money for you and asking who's accountable for how it's spent.
How do we make sure the money goes where it needs to go?
We're posing the question to leaders at the federal level.
It will be Oklahomans making the decision.
And here in Oklahoma.
This money is going to be controlled by the health department and not the legislature, which is a little bit concerning for me.
As our state gets a share of the $50 billion from the Rural Health Transformation Program.
If we don't follow the guidance and we don't have metrics and we are not improving health outcomes, they can claw the money back. We have to make sure we're doing this right.
On the line, dozens of clinics and hospitals across Oklahoma at risk of closing and a workforce crisis to keep them staffed. The hundreds of millions of dollars coming in, a much needed lifeline.
Will the state have to follow any rules that we can make sure it is spent appropriately?
It's not going to be able to be diverted and used for something else. In other words, this is going to go very specifically for healthcare and rural hospitals in particular.
Our state doesn't have the best track record for handling federal money, as years of reports by the state auditor's office uncovered.
We need to make sure that the people who are administering these funds are knowledgeable about the federal compliance requirements, that they are trained to properly oversee and monitor.
A running theme, a lack of compliance and oversight. Oklahoma issuing no-bid contracts, paying out hundreds of millions in Medicaid claims to patients whose eligibility wasn't verified, and misusing tens of millions in COVID relief money meant for education, child care, and rental assistance. We were also recently flagged by the feds for having the highest rate of fraud involving SNAP funds. Will this time, with this money for rural health care, be any different?
Nobody wants to get embarrassed when you bring this kind of money to the state. It needs to be well used.
Leaders at all levels tell us they'll be watching.
This is just a time for Oklahoma to be taking care of the funds we're receiving, because one day we're not going to get them.
I asked the state health department for an update on that first batch of money, if any of it has gone out. They tell me distributing the funding quickly and in accordance to law is a top priority. And on their website, they announced they're going to be sharing the latest updates with the public in a Zoom meeting this Thursday at noon. And you can join in. I've posted that link for you, as well as the health department's full statement on OKCFox.com.
A state lawmaker wants to utilize some of the funding from the Rural Health Transformation Program to put the presidential fitness test in all Oklahoma schools. The test hasn't been in place since 2012, when President Obama replaced it with the Presidential Youth Fitness Program. In July, President Trump signed an executive order to reestablish the test nationally. Senate Bill 1437 directs the Oklahoma State Department of Education to establish guidelines to implement the presidential fitness test based on recommendations from the President's Council on Sports, Fitness, and Nutrition. $4 million to be used to assist in implementing the test.
We spend a lot of money on education, but the second most thing we spend money on in the state of Oklahoma is our healthcare and human services. And so changing lifestyles and changing behaviors as early as possible in young people, getting them excited about the benefits of exercise and making it fun, hopefully builds habit patterns that last a lifetime.
Senator Adam Pugh says the bill allows for flexibility in how schools can implement the test, and they may be able to incorporate the test into PE or recess time. Parents would also be able to opt out of their child taking the test.
Drone technology now being utilized to help improve how rural areas and tribal members access medical care. According to the Choctaw Nation of Oklahoma's Advanced Technology Initiatives, the drones will expedite samples, emergency medicine, and supplies without the patient having to leave their home. The hope is, if successful for the Choctaw Nation, this could become the model for rural health care across the U.S.
They are involved deeply in the process and providing a lot of feedback to the process, not just to make sure that this process is private and secure and safe and easy to use for themselves, but so that other communities can replicate the success of this project in the future.
The Choctaw Nation developed this technology using a $2 million SMART grant from the U.S. Department of Transportation. This is just stage 1 of the grant. After 18 months, the Choctaw Nation will be eligible to apply for stage 2 of the grant, which could be up to $15 million for full-scale deployment.
We're getting a snapshot of how big of an issue healthcare is in our state. Many areas considered medically underserved, meaning these geographic areas and populations with a lack of access to primary care services. Now, this map was put together by the State Department of Health in 2022. You got a lot of light gray areas like these ones over here. They're considered not medically underserved areas or populations. Now, the blue, which you can see in a couple spots around the map here, those are all considered to be areas that are medically underserved populations, and only a handful of counties have these designations. Now, there's one we want to highlight. There's a small portion of Oklahoma County right here that's actually bright purple. That's labeled as medically underserved governor's exception. It's a specialized state-requested federal designation for an area that doesn't meet the federal standards, but still faces unusual circumstances which restrict access to primary care, like some kind of extreme localized shortage. Now, when you look at this map, as you can see, a lot of this is green, meaning medically underserved. So really the question we ask with this is, why do these designations matter? Now, according to the State Department of Health, they help establish health maintenance organizations or community health centers. The State Department of Health also has a map of the areas in Oklahoma that are meeting the federal criteria for shortages of primary care physicians. Most of the counties here either have a low-income population impacted by the shortage or a geographical area.
To help address the state's healthcare shortage, the Cherokee Nation and University of Oklahoma signed an agreement to establish the OU College of Nursing satellite campus in Tahlequah. It's part of the 21st Century Cherokee Healthcare Workforce Initiative. The nation is investing more than $30 million to expand healthcare workforce development, including a new nursing education campus and scholarships for Cherokee citizens.
We have to understand the nursing school is a OU nursing school. It's a public institution, so the best and brightest will compete to get into this nursing school. But we're going to put millions of dollars on the table to make sure that Cherokee citizens who get into this school have low barriers or maybe no barriers in terms of cost. And then what's great for us is we get them to work for us, a commitment to work for us in our growing health system.
The new campus is expected to open in the fall of 2027. And that was your Big Story Breakdown tonight. You can learn more about the Rural Health Transformation Program on OKCFox.com.
Plus, find all of our previous Big Story Breakdowns on our YouTube page. Just scan the QR code on your screen or search OKC Fox.